Every day, in countries around the world, 22,000 children die from preventable diseases. That means every 3.9 seconds, one child dies. In the time you take a breath, a child could take her last breath. To stop the senseless dying of women and children, Medical Teams International has launched a global campaign, 1 in a Million, to raise $2.3 million by December 31st of this year. These funds will help save and change the lives of 1 million children and their mothers in 16 countries. This campaign will help children and mothers like those now seeking shelter against 100-plus-degree days and escaping ongoing conflict in East Africa. It is estimated that 30,000 children have died on the trek from Somalia to Kenya as their families try to find food and water in one of the worst droughts in 60 years.
Some of them had walked for 2-3 weeks, but I was amazed because they were still standing and they still had a smile on their face, so they're obviously extremely resilient people. The children, the ones that had arrived most recently, are definitely the ones that look the most vulnerable. They're the ones showing signs of malnutrition and dehydration.
There were no personnel that could provide them with the health care. They lack water. The children were dying because they had to walk a long distance looking for water.
Medical Teams International currently has mobile medical clinics operating along the Somali-Kenyan border. Our volunteer doctors, nurses, and paramedics are bringing grace, hope, and medicines to those who would die without our care. Our people are on the front lines thanks to thousands who are joining our 1 in a Million campaign to save the lives of vulnerable women and children like those in East Africa. At the Jura refugee camp in southwest Uganda, Congolese families arrive near death after fleeing civil war in their homeland. For less than $3 worth of medication, we can rescue the tiniest children from deadly cerebral malaria.
Well, I think truly this was probably the sickest population that I have dealt with, especially the kids with malaria. By the end of the day, they're no longer seizing, they're sitting up, they're talking with you, they're eating some, drinking some. It's an amazing turnaround, but it takes time and it takes someone that's skilled to do that, and it takes resources. And that's one life that has been saved.
That makes a real difference in places like Liberia, where years of war destroyed hospitals and pharmacies. Now, our health volunteer, Teresa, teaches women to detect early signs of life-threatening problems in pregnancy. Those lessons saved the life of one of Teresa's students and her child. Mema felt pain and rushed for help at a nearby health clinic. Mema says, "If Medical Teams International had not come, my child was going to die." This is just why Teresa volunteers. She says, "I volunteer so my people will not die."
Help our people that are coming to us, so we too can be having something to help ourselves.
The hope and assistance offered through Medical Teams International reaches many places around the globe to help suffering women and children. In the highlands of Guatemala, 1 in 5 children under 5 years of age dies from respiratory infections caused by open-air fires in one-room homes. Your participation in the 1 in a Million campaign helps children like Christian.
When we entered his home, I could tell right away that he was sick, and I touched his face. He had a fever. He was listless. He had a deep, deep hacking cough. The boys were crying that morning because the smoke was so thick in the room that it hurt their eyes.
To eliminate the cause of Christian's respiratory infection, Medical Teams International volunteers worked alongside local people to install stoves. Suddenly, the cause of the respiratory infections was gone.
Those children will no longer be susceptible to those respiratory infections from that smoke. That's a life changer.
When you join this global campaign, you will know your gifts go far to help save lives. More than 97% of resources go to our programs and services. Gifts from a network of ordinary people doing extraordinary things for God. Your gifts will also go far because one family has pledged $200,000 in matching funds, promising to double every dollar you give through this campaign between now and December 31st. Our volunteers, our donors, you. Alone we are ordinary people. Teamed together, we can do extraordinary things for God, changing lives. How many lives can you help change and save for just $2.35 each? Please remember, there are thousands of children and their mothers who are waiting on you to respond now. Will you be that one in a million to make the difference?